we are all ready for you.
Suicidal patients, it's emotional and can be kind of scary managing them. There are patients that you wouldn't expect to be struggling that show up in your office. Sometimes they're struggling with depression. You wouldn't guess it from how they're presenting. You think about, was there anything that came up that I thought was weird or I could have detected or I should have detected? It's hard to hear how a patient feels and them to tell you that they don't want to be alive and they might end their life. I mean, it's hard to talk about that stuff. It's definitely something that you have to spend time training for. I was fortunate to have a pretty good experience with it in my residency training and then, my fellowship to learn how to manage some of those issues effectively and pretty succinctly. I don't think most programs are like that.
I think that all providers understand that mental health is a crisis that's happening right now. In the state of Colorado, suicide is a leading cause of death for youth ages 10 to 19. I'm a trainer at PCMH, and I lead our youth suicide prevention and primary care program. Primary care providers are set up in a very opportune spot to be able to identify and intervene with youth experiencing suicidality because most youth will see their primary care provider within the year. We find that primary care providers are very willing and want to help, but they may not have all the tools right now and they don't feel as confident in being able to screen, assess, and follow the remaining steps of a care pathway in order to best support those youth. So our youth suicide care pathway is a way for primary care providers to follow a concrete set of steps that allows them to identify and intervene with youth experiencing suicidality. Our care pathway incorporates screening, assessment, safety planning, lethal means safety, and then referral and follow-up. The really helpful thing about taking the youth suicide prevention and primary care program is that we incorporated an implementation phase in which we practice those micro skills and we're able to support them long-term. And we really work throughout our implementation phase to figure out how can we make this easier for you to be able to do in your practice so that we can all work together to save lives.
The part that the PCMH does that is very helpful for providers is the ongoing coaching piece. Having a training setting where you get trained, but you also get coached longitudinally, I think is a big benefit because it keeps providers doing the work, it keeps them getting feedback.
Primary care providers have shared that as a result of the program, they now feel more confident in knowing what to do when they identify a youth experiencing suicidality and how to keep them safe until they're able to connect them to ongoing mental health resources. Clinics that do go through the program are screening now at 80% of well visits using the ASQ and the BSSA. I think it's safe to say that we are catching youth that would not have previously been detected.